Just ways to decrease Zoom fatigue. 4 ways. Try and use other forms of communication. So try using email or telephone calling or just messaging people, because video conferencing all the time is not the most efficient for all kinds of work. So try to refrain from using it all the time. Don't force video interaction. A lot of people get stressed out by like the social requirements that can be imposed in like a virtual like Zoom or whatever. So making the work environment less stressful by kind of easing up on video requirements is one way to decrease Zoom fatigue. Having people have their cameras on, it should be encouraged, but it shouldn't be something that you should be punished for not doing. Um, Appreciating the disturbances that can happen at home. So obviously, we are balancing work life or school life with home life. And so it's beneficial to just not judge when there are like background distractions that can happen all the time. Finding other approaches to video. There was a company and they had an interesting idea where they kind of kept their camera off to the side and at a wide angle. So the camera's actually not directly in your face, but if there are ever meetings or a coworker needs to get your attention, they know exactly where you are, and you can interact with them and they can interact with you without having them right in your face. So yeah.
So one very interesting outcome of the pandemic is the shift to telemedicine. And so this move was entirely implemented out of necessity. Before the pandemic, there was a lot of issues with telemedicine. It's very difficult to handle the billing issues, there's legal issues, safety issues. But with nobody able to actually travel or being able to go and see doctors in person, there became a much greater need for it. And so these issues were at least surmounted for the time being. There are significant benefits to telemedicine, so it's much more convenient and it does provide access to a much broader spectrum of people, particularly those in rural areas who may live a long distance away from their nearest health professional. But this, of course, is also a double-edged sword. When we think about convenience, who is this specifically convenient for? There is an issue of access with, depending on what kind of people have reliable access to internet connections, have reliable access to webcams and the technology needed to effectively complete a telehealth visit. This raises an interesting question at this point with a society that is so technologically ingrained as ours is Wi-Fi on the stage to becoming a commodity or maybe even a human right? Just an interesting thing to start to consider. Additionally, cost and time savings. So with telehealth and telemedicine, you don't have to travel to the doctor. You don't need to waste time in the waiting room. Visits are more streamlined. You can kind of back them up together, which allows health professionals to be more efficient and allows you to not have to block out, say, an entire chunk of your day in order to visit a health professional. There are, of course, on the other hand, disadvantages to telehealth. So there are issues with security and the protection of sensitive data. Particularly in a world where it is so easy to gain access to somebody else's privileged information, having everything online, and especially something as unsecure as a Zoom video call can be a major security concern. It is difficult to accurately communicate over Zoom or over any kind of video conferencing software, as many of us have experienced. So there could be issues with accurate diagnoses. If doctors haven't been trained as to how say a skin condition looks over a Zoom camera, they may not be able to accurately diagnose this, and they're relying on communication from their patients who are not medical professionals. Additionally, internet glitches and other technological problems can throw a brick in the works for telehealth. And then further talking about the access question, who has access, this was initially touted as being a major step forward for the elderly. But again, there's the issue of, do they have the technological skills or someone to help them navigate oftentimes confusing setups and user interfaces to effectively utilize telemedicine. So a lot of important strides made forward in the recent years, but still there's a long way to go.
All right, now I'm going to talk about resilience a bit more and how to build up resilience during this pandemic. So resilience is the ability of a person to persevere in the face of hardship, or the ability to bounce back in layman's terms. So everyone is vulnerable to stress, but people who are more resilient can return to functioning capacity a bit faster. And susceptibility to burnout is affected by resilience by a bit. There's also external factors that cannot be accounted by resilience, or personal resilience. For example, people in the healthcare field generally have higher levels of resilience than other people, but they're still reported to have greatest symptoms of burnout. During these changing times, there are some things that can help build resilience. So recognizing when you're stressed is important, and it's good to like try to attempt to manage it. Exercising, practicing mindfulness, and getting a good night's rest all help with this. Taking mental breaks from work and making some time for yourself can help you get to know yourself a bit better and just improve your mental health in general. And maintaining your social connections and not being afraid to reach out for help is also very important because the loneliness and social isolation affect us all a lot physically and mentally. So it's important to try to address it.
All right, we're going to go into another breakout session now. Feel free to finish up any questions that you were not able to get to the last time, but there's also some additional questions if you scroll further down on the same document. And when we come back, we'll be doing a quick shareback session. So if there's any particularly insightful comments you guys come up with, feel free to make a note of them. I'd love to hear some thoughts. Shaylin, if you could send us back out.